what do we think about with soft tissue injuries? What's our concern?
Internal bleeding.
Internal bleeding, okay.
Bleeding in general.
Bleeding in general, right? What was that? Dehydration. So a lot of the, if you think about it, a lot of the management for soft tissue injuries is EMT basic stuff, right? We have to stop the bleeding. We have to stop. We have wound management. We have to take care of that kind of stuff. Oh, input. All right. And so a lot of it's just trying to figure out where the soft tissue injury occurs, right? So you have the skin, like, everybody know what a distracting injury is?
Yeah.
Mm-hmm.
Give me an example of a distracting injury.
You
An
put
ankle.
your arm and it's distracting you from the actual internal bleed that's really the life threat.
Okay, good. So you have something out here that's just, so let's say a distracting injury for you guys. What would it, you walk up on a patient, what's a distracting injury to you?
A lot of blood.
Scalp black.
Yeah. Somebody that half their face is gone, they got big open wounds, you see all this stuff, right? Or, hey, how about they have their femur sticking through their thigh, right? And you're like, whoa, take a look at that. Like, that's the first thing you do, you're like, whoa, that's not good, right? So what does everybody automatically want to do? I gotta go see what this thing's all about, right? Hey, no big deal, the person's not breathing because they're drowning on their own fluid, that kind of stuff. And so, distracting injury for us are those big, obvious, scary looking injuries. But this is where we have to do our trauma assessment. We have to start at the beginning, right?
But wouldn't that be a life threat for a hemorrhage?
Yeah, but if they're not, no, a bone sticking out isn't necessarily a life threat. If it's spurting blood, then yeah.
So
But
then that would be okay to address that before your ABC?
yeah, but you're reading too much into the wound that I gave you. Okay, so what I'm saying is distracting injuries are those injuries that take you away from. They look nasty, they look really bad, but in all actuality, they're really not. They're not going to kill the person, right? And by you getting sucked into those injuries, you run the risk of missing some of that life-threatening stuff. Okay. All right. So right there, rarely life-threatening. What part of the body is this?
It's a limb.
Some limb.
It's a limb.
Okay. Maybe tricep, I don't know.
So what do we want to do for this? How would we manage this?
Direct pressure.
Doesn't look like it's bleeding, except for like actively.
But it looks like there may be some skin.
Pat, gauze, and splint.
So you know, I think the first thing I might think about doing is maybe seeing if the patient's breathing to start off with, and then see if they have a pulse, and then see right. So once again, so I mean I kind of set you guys up on that one by the way I asked the question, right? But what I'm saying is like, so you have these types of injuries and stuff, and it's the stuff that you get distracted by. It's the thing that your eyes get drawn to, right? But you have to go back to your ABCs: airway, breathing, circulation, major bleed stuff, right? Is this a major bleed? Looking at it?
No.
No. Is that a oozy, nasty red something with skin's missing?
Yeah.
Yeah. Is this person going to die from this before you get to the hospital?
No.
Could this person potentially die from this long term?
Yeah.
Yes. Okay.
What body part was that? I'm just wondering.
I was gonna say it could be a thigh with like maybe like the leg running down the way. It could be like
Yeah, that's,
you say I don't know if that's the foot of the bed down there. Like this is the knee or down here.
do we just know what the injury
There's
was?
the hand. No.
Okay.
All right, so we're not gonna get into the wound packing and stuff until we're gonna do that in the lab when we do our practical stuff over there. Did we end up getting all that wound packing stuff, Chandler? Did that? No. No. But I think what we're gonna do is we're gonna potentially have the people that teach our wound packing stuff come talk to you guys, and they're gonna talk to the EMT basic class as well, maybe next term, to get you guys kind of up to date on what the local protocol is for our ABI wound packing, stump packing, stuff like that. Because we'll actually do stump packing where if there's an open bone fracture, we'll take stuff and we'll shove stuff in in the end of the bone and stuff. It's actually kind of fun to do. We have a lot of different like dummies and stuff that we can use to do that kind of stuff. So the basics of stopping the bleeding is
Direct pressure.
direct pressure, right? Elevation, tourniquet. We're going tourniquet, tourniquet, tourniquet a lot now, right? Yeah.
Do we elevate the wound anymore?
Not as much, but you'll see people at the basic level that do actually, they do the whole
Right.
thing. And so for us, we actually, half the time, we skip pressure points, we skip the elevation, and we go direct pressure. If that doesn't work, we throw a tourniquet on,
Right.
and then we move on.
How
right?
old is this slide?
I don't know, to be honest with you. So what happens if one tourniquet doesn't work? Do we go proximal or distal? So we put the first one on. So say I got a brachial artery spurting right here. How close do I go to it?
2 inches.
2 inches, right? 2 inches just above it. Boom. Apply tourniquet. So where's the next tourniquet go?
Above that.
Up higher?
Yeah.
Okay. How far do we crank it down?
Till the
The bleeding stops.
What happens if the bleeding doesn't stop on the first one?
When you put a second one on,
Well, how do you know if you keep cranking and cranking?
Okay, you can't crank
When do you know when to stop on that first one?
the arm pops off.
You end up with a glove injury because of the tourniquet, right? Is that a trauma activation?
Yes.
Yes. Okay. So you get to that point where it's like, hey, I'm gonna break the tourniquet if you have the ones that have the plastic parts on them when you're turning them. You're like, I'm gonna break this if I go any tighter, right? So you get to that point where you're just like, okay, this one tourniquet's not working. I have to move to the next tourniquet, all right? Because that's one of the funny questions that I'll ask people is just like, they're like, hey, I go till the bleeding stops. It's like, yeah, great. What happens if the bleeding doesn't stop on the first one, right? So something to think about. All right, so as we do it, so don't worry about this part here. A lot of it is doing our full assessment stuff, right? We're gonna do our whole ABCs. Symptoms that patients present with. So if they have an injury, is paralysis or loss of sensation important to us?
Yes.
Is that a medical / trauma emergency? Yeah, anytime somebody has nerve damage, circulation damage, anything like that associated with an injury, it's something that is potentially life-threatening. Can they lose a limb if they lose circulation in their hands?
Yes.
Yes. If they get blood clots in their hands, can they lose limbs? Right? So you treat injuries just like we do blood clots and stuff. Severe pain. How do we manage severe pain?
Narcotics.
Drugs.
Drugs? What kind of drugs do we give? So how do you choose between all of those drugs that we have?
Great question. I've been asking that myself.
So it seems like fentanyl is going to be our first line of defense, or first drug of choice,
Okay.
because morphine used to be, and morphine's going out. And then if we have a patient that is able to state they have a history of opiate addiction, then we can go with Toradol.
Nice. Everybody catch that?
Yeah.
So fentanyl is our drop to go to that one first, right? For multiple reasons. It's fast acting. It's potent, like as it gets right to it. It's crazy how it affects some people really well and other people's not very much. Like you can give one little old lady 25 mics, and next thing you know, she's just like, you're like, oh, you're like, hello, did I kill you? Hello, right? And then you'll give another lady 25 mics, and it's like nothing. You're like, okay, here's another 25, nothing. Okay, all right, we're now up to 200, and it still hasn't affected you, all right? And so people have different thresholds on how those medications are going to affect them. And there are a lot of people that they'll be like, hey, how much pain are you in? And they'll be like, because I can start an IV and I can give you pain meds if you want. And how many people out of 10, on a rough estimate, how many people do you think accept pain meds?
About five.
Like 8 or 7. 7, 8.
7, 8. Is 7 the low? I would say about half the people say, no, I'm good. Right? Because a lot of these people either haven't had pain meds before, so they don't know what they're missing. Or just their way of dealing with it is, nope, I'm gonna ride this out. I'm gonna be tough. I'm gonna handle this. There's other people that will be like, yep, give it to me, yep, give me, this is horrible, right? And so all of these are just gonna be how your patient's gonna present on whether or not, how much you're gonna give, what medication you're gonna give. If they say, no, I don't want any narcotics because they had an addiction before, yeah, there's no sense in ruining their wishes when we have something that can kind of help with the Toradol. And so it's just something that communication with your patient, right? Do we give kids pain meds?
Yes.
Huh? Okay, right,
Tape
prostate
say.
tape, right? But in the pre-hospital setting, we are very hesitant to give pediatrics pain medications. Why do you think that is?
Addiction.
Threshold or anything?
So do we give adults pain meds like there's no tomorrow?
Yeah.
Yeah, we give it out like it's candy. But when it comes to kids, what's the most common route that you gotta give pain
IV.
meds? How many kids really like needles? I have 3 of them that it's like the end of the world, like the apocalypse when they hear they have to get their immunizations. And it's like, don't I already told you, but my sophomore is the biggest emotional wreck when it comes to IVs or immunization stuff.
What did you
Right.
do wrong in your training with it?
Well, it's funny because I use IV needles to get slivers out at home, and so they're just scared of needles, I guess. But so a lot of the pre-hospital setting is uncomfortable because we don't really see a lot of patients that we treat in the pediatric region, right? So we don't see a lot of kids that we're transporting and stuff. Kids hate needles, and so they're like, hey, I don't want to make this kid any more unhappy. Do kids need pain meds?
Yeah.
Absolutely. Cool thing is now they have the ability to give intranasal fentanyl. We have those abilities to give those things. The other thing is, for a while, has anybody heard of fentanyl lollipops?
Yeah.
Oh.
No.
Fentanyl lollipops, self-regulating meds, right? Give the kid this sucker. He starts sucking on this thing,
Crunch.
right? But they tape it to the hand so that what happens when the kid gets so sedated, right? So it's self-medicating. Obviously, mom and dad are sitting there in the ER bed waiting, right? But it's funny because it's legitimately self-regulating. Like they'll suck on for a while and then it just falls out. And they're like, oh, I guess this kid's comfortable now. So,
Try, I guess, I was looking at our drugs, and we have Versed and also ketamine that potentially say that we can give for ortho injuries.
mhm.
When would you determine to give those? When would you decide to give those as opposed to fentanyl?
So we actually combine ketamine and fentanyl a lot of the time now. Like we do like a conscious sedation stuff. So a lot of it's just dependent on, so people are in regular pain, right? And then there's that pain that you can't hold still, like your behavior is affected because the pain hurts so bad, right? Like people just have different reactions to pain. Like for a long time we used to be able to give Versed and morphine together. They called it conscious sedation. Well, when they gave us that option in the pre-hospital setting, what did we do as paramedics?
Gave it out like candy.
How did patients show up to the ER? Like needing airway management almost, right? So they just recently gave us back the ketamine and the fentanyl to be able to do pain management on stuff. We'll see how long it lasts to see if we start giving it out like candy again.
So that's like super severe, like
Right.
fentanyl's not working, let's give ketamine.
Yep, if I had somebody with an open femur fracture and I know I'm gonna have to pull traction on that, or like severely angulated femur, where it's just like, well, this is really gonna hurt, I'm gonna go with the ketamine and the fentanyl, right? Because I flipped the script, I'll be like, if I was sitting in that position, and that's what my leg looked like, and that's how, I can only imagine how it felt, how would I wanna be? I'm just like, just put me out, whatever you need to do, put me out, just keep me breathing, right? So, versus somebody that, hey, maybe I have a hairline fracture in my hip, kind of hurts, I can't put weight on it, but it's gonna hurt to get you from here onto our gurney, the right in, then you just kind of easy dose it with the fentanyl. Make sense? So we do a lot of our assessment, physical exam with your nerve and motor function, right? your CMS, you're checking CMS all the time, right? So how do you test that? I know you guys we do this, hey, can you tell what toe I'm wiggling? Hey, wiggle, move, push. I mean, is that how you guys still do it now? Now that you guys are paramedics? Now that you guys are thinkers? You guys still go back to that textbook, push, pull, can you feel me touch you here, can you feel me touch you here?
I'm sure there's a better way.
There's all kinds of different ways to do neuro exams, right? So, like pens and needles are really good because they got a little bit sharp stuff to them, right? So you can go through, and a lot of times what you do, because you now want to know more specifics about neurodeficits, right? Oh, hey, no, I can't move my feet very well. At the basic level, you're like, oh, okay, I'm checking that off. Okay, can't move the feet. But what do you want to know as a paramedic?
If you're hovering the needle somewhere close to their toe and saying, can you feel it? And they go, yes, I can, or I can't.
Right, so you can, I mean, you commonly will run fake, hey, can you feel this? Can you feel this? Can you feel this? Can you feel this? How about this? Right? So you're constantly trying to evaluate the information that you're getting. At the same time, as a paramedic, you want to know where, right? You're running all the way up the leg. You're checking that neuro deficits all the way up to try and figure out exactly where they have the sensation and where they don't. And why do you want to do that?
Figure out what part of the
Fitting
spinal
the
cord
level,
is
the injuries
injured.
in the spine.
Right, what is that going to do? What is that going to do as you present that person to the ER?
It's gonna give them more information.
It's going to give them way more information than, hey, this person has paralysis here. It's like, okay, well, what kind of paralysis? Do you have just numbness? Is like half the foot numb? Is this like, so you get a lot more specific at the paramedic level now when you're performing those types of assessments. Because you guys have the terminology and the ability to be able to pass that information on to the doctor versus the basic type thought process of, yep, they got numbness tingling in their foot. It's like, okay, great. Instead, you can walk in and you're like, hey, you know what? So the medial side, medial malleolus location is numb, lateral is okay, everything up above that, all neuros are intact. That gives them a lot more specific information. Plus, you get to put that in your chart, right? Because that shows you're doing the assessment on the body versus push, pull, okay, good, grips, all right, yeah, good, our full CMS. All right. Oh, injury location, face and neck. Lots of blood, right? People get hit in the face, cuts on the face, right? Cuts on the ears are big ones. What do?
Bleed.
Are they hard to control the bleeding?
No.
Just grab it.
These are easy. Why is it easy to control bleeding on the head?
Because there's a hard spot behind it.
Hard spot behind it to compress the capillaries and the vessels, right? Right, so it's super easy, but man, they look bad, right? So when you have a cut on the back of the head, so say somebody got hit in the head with a 2x4. Somebody came up behind them, hit him in the back of the head, right? Is it going to split the scalp open?
Yeah.
We're
Most
going to say it
likely.
wasn't hard enough to break any bones, but it split the scalp open. All right? So, Mark got hit in the back of the head. His scalp split open. Is it going to be very easy to find where the injury is?
No, no, no.
Right?
Just cut that
Yeah, right.
Right? So that's going to be rough to find it, right? Is there going to be a big old mass of stuff back in the back, like where it looks like things are deformed and swollen and stuff? Potentially. But guess what? What you're going to have to do is you're going to have to get your gloves dirty. Okay? It's hysterical. Like, I'll watch people. I'm going to use Josh as an example. Oh, we don't mind Josh, but we don't have lice. Right? So I'll watch people that go to do this assessment on the scalp, and they're like, well, I don't know. I can't see. You know? And like standing back here with a flashlight, I'm like, what do you mean you don't see? Like, you see like this massive blood clot. It's like, I'm going to say it's under the blood clot. Like, let's just create a little flap and try to get up underneath there to see, right? But everybody's just so worried about like disturbing that blood clot, because what's going to happen if they disturb the blood clot?
It's gonna bleed again.
You're going to start bleeding again, right?
But you gotta find it.
But you need to know, hey, can I stick my finger into his brain? Or what's going on back here, right? So you actually are going to have to get your gloves dirty. And so there'll be times where like we'll get dispatched to a certain kind of call, and I'll grab 2 pairs of gloves. I'll put 2 pairs of gloves on because I know I'm going to get the first pair dirty. They're going to be bloody, right? And I don't know how many of you have ever had the great opportunity of having a stressful call, taking your first gloves off, and then trying to get a new pair on. Your hands are sweaty, they're wet, it's virtually impossible. And I learned this thing where if you take it and you go, and you blow into it, and you create this kind of balloon thing, you can get your hand in a little bit farther. But what does that do now with blood and
On
stuff
your
all around
face.
you, right? Put your face, right? So I was just like, that's a horrible idea. So I just double glove it, right? But then you're sitting there like, I can't move my fingers. You're like, well, okay, these ones are done. Whew, okay, right? So face and neck are really, really very, very capillary-based vessels, lots of bleeding, okay? They look bad, but most of the time they're not that bad. When do they become bad for us?
Well, there's an artery in there.
Keep going. Think about this area here.
Front of the face?
Face and neck. Where are we most concerned about bleeding?
Airway.
Airway, right? Because everything else we can basically put pressure on as long as we're not pushing pressure into the brain kind of thing, right? So stability first, then pressure. But anytime we have bleeding in the airway, that's when we get concerned, right? Big deal for us. Why is that a big deal for us?
Because
It's a big deal for them.
we've got to do something to control that
Because
airway.
we have to do something to keep that airway under control. So what do?
Suction.
Worst case,
Suction?
worst case innovate.
That's not the worst case, dude.
Okay.
That's
worst
like
case,
middle
right?
level. That's like middle level. What's worst case with
Right.
facial bleeding?
Right.
Right, that's worst case. Okay. All right. Lower extremities. All right. These are these big lacerations. You get avulsions, stuff like that. So less blood flow, prone for infection. What types of patients are very, very prone to infection with like a small cut on their foot?
Diabetic.
Homeless people.
Diabetes.
Diabetic, right? How many people do you go on that don't have their toes? So they have poor circulation already, so then they can't fight infection. So a lot of times it'll start with like a small little cut, right? They'll get gangrene, poor circulation, infection. High dose antibiotics don't work. Next thing you know, they gotta take it off, right? Irrigation. Oh. We irrigate?
Mm-hmm.
Yeah?
Yeah.
Somebody takes a crash and burn in the gravel. They got rocks and stuff embedded in that. Or let me use the one we had yesterday. It was awesome. Chemistry teacher teaching his middle schoolers about chemistry reactions, right?
Uh-oh.
Well, the chemistry teacher, not being totally aware, grabs a glass beaker. In retrospect, he should have had a plastic beaker, apparently. Combines the chemicals, boom, beaker explodes in his hand. Right?
Shatters.
Shatters, impales in his hands.
Oh.
Right? So he's got like glass in his hands. So what do we do for that?
Clean it. Well,
Irrigate the glass out?
Huh?
Where do you remove the glass?
So you have small little shards that are in there. So you can treat shards just like you would gravel, right? Like small particles. Now, would you expect there to be a major, like when you have little shards of glass in there, you're not expecting major nerve stuff, right? Now, let's say you have an entire thing embedded partway in your hand. Nerve damage potential?
potential.
Do we mess with that?
No.
No, right? So there are times and places for irrigation and debriding of stuff, right? But anytime anything is more than just a very light superficial, we stabilize in position, we wrap it up, and they go to the hospital like this, right? So with these small things, we can irrigate, right? Because, like, do all people need to go to the hospital?
No.
No. Do people need to go to urgent care? Maybe they need stitches, staples, yeah?
Yep.
Right? Is it okay if we irrigate beforehand to get them wrapped up, packaged up, get them clean so that they can go in their car and stuff? Absolutely. Right? What are they gonna do when they get to urgent care?
We do the same thing.
They're gonna open it up and they're gonna irrigate it out and they're gonna clean it some more, right? So it's okay to irrigate, it's okay to use tap water if you have it. But what are we ultimately trying to use? We try and use our saline, right? We have saline flushes, saline bottles, all kinds of different saline that we can use for irrigation. Is it gonna get messy?
Yes.
So the key with this is setting yourself up for success of knowing where all this runoff bloody fluid is gonna go, right? So a good thing to do is take people and towels, put them out over the top of towels because the towel will absorb both the fluid and the blood.
Maybe a towel over the top where you're pushing. so it doesn't splash.
Yeah, yeah, and what do we always have on when we're irrigating?
PPE.
Goggles, right? Gotta have it. So let's see, so we kinda talked about that a little bit. All right, so you go on this call.
My God.
So let's take a look here first. No cheating and looking at the result here. Okay, so this guy was doing some woodwork or something, I don't even know what he's doing, looks like maybe like a glider or something even.
Yeah,
Is that a
it looks like
ski?
a hang
Oh,
gliding
yeah.
thingy.
Yeah, it looks like a hang glider type of thing. So long story short, this is you. Oh, jeez, I quit. All right,
Want someone with a chainsaw?
so, what do you guys think?
Sick.
No, but
Yank
if
it
there's
out.
a tree trunk from, I don't wanna take an entire tree trunk.
How are we gonna deal with this
I'm gonna
person?
cut it to a
Distract
manageable
the
length.
injury, how's his airway?
Oh, thank you.
Yeah.
Woo! So he is breathing, his airway is clear, but he's breathing at 40 times a minute, and he can't catch his breath. Don't look over here yet.
Let's get lungs
I'm making
out.
stuff up, okay? I'm making stuff up on what's going on over here first. So don't look over here and see all happy-go-lucky guy over here taking selfies.
Let's get lung sounds and look at the chest to see if there's,
So he has no lung sounds on the right.
let's look and see if it's tension.
JVD.
Yeah, any radio
deviation.
deviation,
Open chest
Fuck you.
wound.
Seriously?
Well, is there an open chest wound? Huh.
Let's
It looks like it's pretty sealed to me.
Fix the
Most part.
Yeah, it's the shoulder. From a shear everything.
Okay?
I love the partner, the bedmate,
Just staring at it.
like,
What the heck did I get?
Okay, so obviously your priority is airway, breathing, circulation, right? Does this appear to be major hemorrhage?
somewhere in there.
Not currently.
Could be
It looks like
blocking
it's-
the artery that it's.
Based on this, can you tell me that he's not bleeding majorly?
Somewhere.
Externally, is he majorly bleeding?
No.
No.
No. So on the outside, things look kind of good, but you have no idea what's going on the inside. There's a lot. What kind of major vessels run along right here? Subclavian, right? So you got major arteries up there. Let's say he does not have sensation or pulses in his right arm. Sick or not sick?
Sick.
Life-threatening sick?
Yes.
Yeah.
Okay. Why do you say he's life-threatening? I mean, obviously limb-threatening, but why do you say life-threatening?
Because that major artery, something has caused that major artery going to the limb to not be passing.
Good.
And so,
So there's no blood flow here, which means that blood flow that was normally intact is probably going somewhere else, right? Like into open cavities. So how are you gonna get this person off? Off the. No, can you say oh wait, no. How are you gonna get this person disconnected from this piece of wood here?
That's what I'm saying, a chainsaw. Or
You're gonna run a
maybe a
chain.
handsaw.
So you want to run a chainsaw
No.
on this piece of wood right here.
Here's the only
Vibration for that.
Very
The
sharp.
only reason I'm saying that is because a handsaw would take way too long and could cause more movement.
Get a laser.
If we could, that
You know
would.
what? If we just had enough water, we could soak it in water and it would just rot, and then it would just. We could do it that way.
time and water.
Time and water. That's all we need, and it wouldn't even cause vibration.
We just
wouldn't-
burn it out.
So this is where knowing the tools that you have available to you to be able to make this. This person, we're not pulling it out, right?
No.
We don't do that kind of thing.
No.
Does this guy have the potential to die right here, right?
Yes.
Yes. Okay. So we're gonna cut it off as close or as far as we need to. Like if there's something that, hey, we have a small little part over here, we're gonna cut it at the easy spot, right? And then we're gonna be like,
How do we?
all right, can you fit? Can we fit you in our ambulance, right? So you're gonna have to be able to make transport, and you can see they were able to get it cut pretty close. You see here, it looks like maybe a beaver, like ate into that, and this was good, right? Because if you look at it, it looks like, I mean, it's not very far out here. It's probably only like that, but if you'll notice the cut pattern, it's not a flat cut.
Because they're cutting away from the space.
So, just something to think about as you do things, okay? So he's awake and talking to you. Okay, he talks to you the whole ride in. What's your thought process on treatment for him?
Stabilize, large bore IVs, watch his blood pressure, trauma
Why is it, what
activation.
trauma activation criteria does he meet? To where?
The chest cavity.
Okay. Torso? Yeah? Head, neck, or torso?
And high mechanism.
Yeah.
And what?
We could assume there's some sort of high mechanism associated with it, but we're not gonna use the easy mechanism thing, we're gonna use the ones that we know that are mandatory,
Airplane.
things, so. So treatment-wise, you guys wanna just,
Pretty trajectory information on that aircraft?
couldn't find out, it was, no.
Or else it would be a little color.
So, before you do anything with this patient, what do you wanna do? Give me a roll. ABCs, right?
ABCs.
Airway, breathing, circulation. So he's breathing at 40 times a minute, having a hard time breathing. Pulse is 140. Blood pressure, you have a weak radial pulse.
On all
And he's
radial,
pale, cool, and diaphoretic.
all radial pulses,
No, he has no radial pulse on the right,
but the others weak.
but the other one's weak. What?
Treat for shock.
Okay,
Well, so
that tells me nothing.
we want to make sure
That tells me EMT basic answer.
he's not losing his core temperature.
Like maybe.
Get IVs. Watches SpO2.
Are you gonna start an IV in the right arm?
No.
Probably not.
Are you gonna start an IV in the left arm?
Yes.
Are you gonna start an IV in either leg?
Yes.
Are you gonna start potentially an IO?
Yes.
If you have to, right? Worst case scenario. Okay, so IVs, fluid resuscitation, what else?
Coach's breathing, maybe give him some oxygen.
Okay.
Continue to monitor that.
Continue to monitor his lung
that
condition,
lung
what you
sounds.
got going on over there, right? This patient is gonna be one of those ones where you follow up, follow up, follow up, follow up. Okay? Gotta continually follow up on this person. Keep tabs. Hey man, how you doing? How
Do
you
we
doing?
just
Doing
watch
okay?
his social media account or look at our patient from these posts?
Yeah.
Sorry,
Uh,
this is
See?
the smart ass in me.
Yep, that's cool. Okay?
And make sure to limit the movement.
Are you gonna do anything to stabilize this?
Oh yeah.
What?
Try and secure it.
Man, have somebody manning it, just somebody holding it, and that's their job, to make sure it doesn't move as much.
Backside must have worked.
It looks pretty stable.
So it's gonna try and cantilever over, right?
Yeah.
So it's gonna be like,
Especially when you're cutting it.
yeah, so this is gonna be the key, is just getting the person disconnected.
Yeah.
Yeah, yeah, okay?
Why
That's gonna be
is
hard.
just the injury pixelated, but nothing else?
Yeah, I don't know.
Who knows?
This shows the inside of a body, maybe? Okay,
What the?
so,
Yeah, I see.
That was a bad place to crash.
so bad place to crash, right?
All right.
So
Airway?
it's going around, did they just like?
Airway's not open.
So, no, it's the bug in it. Okay.
Is there a pulse?
There's a lot of blood on the ground.
There's a weak,
Can we clean up the blood on the ground first?
hold on, so there's a weak carotid pulse only. It's at 160.
160, weak carotid pulse.
Cardioverter, right?
And the airway's not clear?
I mean, you guys want cardioverter, right?
Yeah.
What if I said it was 180? Cardioverter?
Yeah.
Anybody?
No.
No?
Not yet.
Finally. Yes, no more cardioverting. Cool. Okay, so we're gonna say, yeah, he's tachy at 150, weak threaded, carotid, very, very weak.
And what, you said the airway is not clear?
Yeah, he's got gurgling coming from his mouth.
Is he
All right,
responsive?
Breathing about 4 times a minute.
Is he responsive?
No.
Okay.
Hopefully not. So we're gonna have to deal with suctioning and try and intubate and look at
What do
take
you
his
need?
clothes off.
What do you need?
We need to cut him
212
You
out.
can see it.
You guys need a lot of stuff, right?
Yeah.
You need equipment, you need personnel.
Cut those ones out.
Do we even know what's going on here yet?
No.
We have no clue what's going on here, right?
No idea.
If I come up on this person, what do you think the first thought in my mind is as I
I'm
look
off
at this?
duty.
Got all the clothes?
I'm off duty.
I quit.
Yeah.
I quit.
That would be my question. At what point do you not worry about the penetrations and go, I need to get this guy off so I can get his airway clear?
Right?
Dude, you gotta
I mean, it's that easy. It's that easy, Justin. See, now Dustin didn't catch it that time. He's the one who corrected me the last time, but he didn't catch it this time. See? So, life over limb, right? So you end up at that moment where you're life over limb, okay? So this person, if I walk up on this person, first thought in my mind is there's no way this guy's alive. No way, right? I'm just like, because I mean, look at the leg, look at
Yeah.
what all this stuff is, I mean, it's just.
Is that pink trophy?
That's pink,
Yeah.
pink stuff, right? And it looks like there's a lot of it there, okay? And then this, there's nothing natural about
Right,
this.
it looks
Right?
like
You look at
something's
the
holding
one
that.
next to it and go, it's probably, what
Yeah, probably similar to that, right?
Yeah.
It was before he hit it.
That went to his hand too?
Yep, in his hand, so he's impaled in his hand.
Distracting is great.
Look, his hand, it's impaled. Who cares about this? We got his hand, right?
Maybe he has.
We'll save his hand.
So yeah, so as you come up on things, you gotta go with those airway, breathing, circulation. Okay, we have that stabilized. Realize you're gonna need additional resources to get this person away from the rebar. And then how you can get them disconnected from the rebar.
You're gonna have to cut it.
Or if you have time, you can.
You
You have
think this
any
guy's
history
dead
of
or
that?
alive?
Do you have any
Yeah.
history to that?
He's dead.
Super
He's
dead.
dead.
Was that you? Wait,
Alright.
I was like, is that the same person?
That was.
Clean.
Woo!
You're working snow patrol,
Nope.
right? You get the
Oh.
paramedic on. They bring this person in, and you can see, I don't know, it's kind of hard to see, but it goes through his lip and out his mouth.
Yeah.
It's a branch. He snapped it off. All right. What's our treatment?
Airway.
Is our airway open?
Yeah.
Well, you got
I
time,
mean-
so-
Well, we don't know when we first got there, because his mouth had been full of blood.
Oh, his buddy wrapped him up on the hill. He just happened to be like a off-duty EMT basic. Does a lot of volunteering in his day, so he carries 4x4 wraps and conform with him at all times. So he got him wrapped up, and that's how he showed up into your clinic there on the mountain. So his airway's open, yeah? Because obviously he wouldn't have made it down off the mountain with a closed airway, right? What are we concerned about?
That, where that stick is. Is that in his neck, chin,
So
airway?
like, what all is here? So what do we do if we get given him? What's the first thing we're gonna do?
Check his airway.
We gotta see, we gotta get to the root of everything. It's like, yes and no questions. This hand works good, right?
Yeah.
So depending on how well he can communicate, it's give me a 1 for yes, a 2 for no.
I
Because is
think
he gonna
he's
be
a
able to
more of a
talk?
thumbs up, thumbs
Well,
down.
Thumbs up,
we-
thumbs down. There you go.
So, clarification question, is the branch going through his lip?
So it comes up, maybe like right here, and then up through his lip, and then back out his mouth.
So, wouldn't we have to cut the bandages off to see the extent?
Right.
Yeah, but do you wanna show up with this person in the back of your ambulance, say, hey doc, this guy got delivered to us, here you go. Having no clue what's going on in there.
No.
No, so we're gonna peel this off. Did a decent job wrapping them up. We're gonna peel it off, take a look, make sure that there's nothing that we need to do to manage the airway, manage his breathing, make sure there's no major bleeding, that maybe he's bleeding here, bleeding back down into his airway, right?
Yeah.
So things that we gotta work on. So say, as you're treating this guy, his LLC starts to diminish.
Why?
I don't know.
I mean, that's my question of, LHC's starting to diminish. Why is it starting to diminish? So I'm thinking, is
He's
that,
getting pale, clammy, and diaphoretic, feels like he's gonna pass out.
right,
Well,
is it because of the,
Hit a tree somehow.
because of the pain, or is there a bleed somewhere
You see
in
nothing
that?
obvious.
Right, that's
Can I guess
my
an
question
injury?
of my thinking of,
Right.
is there a bleed I'm not seeing? Why is
Can we
he?
think a head injury since he had to hit a tree? He had to be close to a tree.
No,
He
look
still
at
had
his
to-
helmet.
No,
I
helmet
see
looks
nothing
good.
on his helmet. I see nothing on
Yep.
his
His
goggles.
goggles are all intact.
And he was talking to me when I first showed up. He was
Right.
thumbs up when I first showed up, and now his LSD's going, and so that's the only injury I'm seeing.
Is there other
If
injuries?
he's that close to a tree, did he hit the tree with his chest, but there are no external signs, so go for lung sounds and see if there's anything
Secondary.
I was gonna say, go ahead and expose the chest, look for impact.
Okay. So you find
I'm
nothing.
not gonna say that I've never done this.
Right.
It hurt like a son of a bitch, wasn't that bad. But
Yeah.
there's a lot of other stuff in that close to a tree.
Yeah.
Scratches
So
all over you.
you find nothing.
So
Nothing.
I'm thinking
Cool.
internal.
Right.
Something
So you have to
internal I can't
automatically
see.
assume either somebody's having a psychological effect of this because when people are in pain, they'll send their body into going into shock. Oh, I'm losing my vision. Oh, there I go. Right? Has anybody ever had that?
What was the question?
right? Oh. You ever had that moment where like you're in so much pain that like all of a sudden you get dizzy, lightheaded, and get, oh, and I'm gonna pass out kind of thing? Yeah, right? So maybe he's having one of those moments, right? Or what do we think as paramedics?
He's losing blood somewhere.
Worst case scenario, okay? All right, rebar.
What was wrong with him? Why did he lose his
I was making stuff up.
Hey, good news, your heart's not moving.
Well, I thought heart attacks still heal. You don't necessarily have to be running your head twice damage, so it lasts pretty fine. Those helmets still look pretty good. I think it's just solid ice.
So that's all stuff that you gotta rule out.
Okay.
Okay. All right, so we're gonna say that this guy was at a construction site, tripped, fell over backwards, shunk, down onto the rebar. So he's still currently impaled on the rebar.
But he's no longer on where the rebar was.
Nope, he is. The rebar, like he's laying down.
Is that rebar in concrete or is it just loose?
That looks like a
It
mattress.
is
That looks like a
in
mattress.
concrete.
Yeah, that's
Is
why.
that-
In concrete.
That's why I'm wondering if it looks like he's laying on a mattress right now.
Yeah,
I'm making stuff up
if
as
he's,
we go, Allie, for the goodness.
if he's on a slab, a big
So
slab
he's on a
of
big slab of
concrete,
concrete
with
with
that
this
sticking
rebar
out.
sticking up out of it.
And you
that's
can't
gonna be a
get
trauma surgeon
Yeah.
on scene.
Huh?
Lung sounds.
Lung sounds, oh man, how about we check his
Can you
airway?
check if he's
Airway is breathing,
first of
he's
all?
having a hard time breathing, what are we gonna do for it? He's breathing that,
Continue to watch it and monitor it to see if it tensions out.
What's his
or-
rate, rhythm, and quality?
oh, thank you, Dustin. Back to the basics, there are good basic times that we, okay, so he's breathing 28 times and deep. Says he can't breathe though,
Is it labor?
Deep's
So that
good.
means-
it's not labored.
Is it?
So we need to calm him down.
Oh, you're gonna talk him off the edge, huh? Let's just talk him off the edge. Hey, buddy, I know it's a big deal. You see this thing sticking out of your chest. Just mellow out. Just
He's not going off the edge, he's stuck there.
right. Yeah. So obviously we're gonna so as paramedics,
No, it's true though.
getting him off of here is not necessarily gonna be something that we can do, right? We're gonna need special resources for him to get removed from this, right?
So we're stabilizing on.
Obviously, there may become some point where he becomes dead, and you're on the line with medical control, and no other resources are there, and they're like, yeah, just pull him off. And then you just pull him off, and then what kind of if he was basically dead already, so what are we now working?
Oh,
Now we're doing this whole trauma code. Now we're like, okay, do we do this? Do we not? He was just talking to me. Oh, geez, here comes one of those paramedic decisions I gotta
I
make.
work it because I
Right.
saw him a lot.
So I would have a hard time not working him as well, because he was just alive. I'm like, dude, if I can just keep things circulating enough, give him enough stuff just to get him there, maybe they can crack his chest and it's a bleed or something, right? So that's my, like, I'm throwing out that 1 in a billion chance, but it's just like, hey, the guy was just talking to me. I have a hard time when people say, oh yeah, we were transporting this person, they were conscious talking to us on scene, we were transporting them to the hospital, they were in an MBA, and they went pulseless and apneic, and so we stopped because it was a trauma code. I was like, what? I was like, this person was just talking to you. I'm like, you got like a 10-minute drive to get to the hospital, and then let somebody that has a little bit more education and thought, because there are bad paramedics out there, not pointing any fingers, that you just, it's like, dude, just give them a little bit of a chance, okay? So. All right, contusions versus hematomas. Oh,
Ooh,
is that bad?
it's not good.
So what's happening here?
Blood.
So you're getting a large amount of blood. What commonly happens with these that people have to have done? So anybody ever smash their fingernail and it bleeds underneath their fingernail? And it's like the most painful thing you've ever been through. But then if you simply just take a needle and you just put a little hole in it and all of a sudden it basically like explodes, what happens to the pain? It's almost instantaneous. It's just like, right? So there are times where large hematomas will have to be drained, right? They'll have to be lanced, they'll drain it out. So a lot of these, when it comes to the hematomas, do we go on people that have hematomas?
Yes.
Like they end up with a giant like swelling underneath the skin. What kind of patients do we normally go on that have those? What are they normally on? What type of medication?
Coumadin.
blood thinners, right? So they're like, ooh, I fell down, I hit my elbow. Next thing you know, their elbow's like this. The best ones are like after you guys start IVs on them. They're like, oh, boom, you start the IV, you blow the IV, right? You wrap up their arm, you go over here and working on this arm, and all of a sudden you look over and the little old lady goes, excuse me, I think there's something wrong with my arm. And you're like, yeah, and you're like, I can't bend it. Of course, you haven't given her the time of day yet to actually acknowledge it. She's like, I can't bend my arm, and you're thinking, yeah, it's because I wrapped it up. Yeah. And all of a sudden you look over and it's just like the whole AC area is completely swollen, and they're like, because it's got this giant hematoma that's growing, right? I kid you not, this is the kind of stuff that happens. You guys are gonna like, first couple times it happens, you're like, that's bad. What do I, oh jeez, what do I do? What do I do? I'm gonna let this person bleed out because I tried an IV on them. They're gonna bleed out in their crick of their arm, right?
Is that with the pressure wrap?
So that's the thing, is a lot of times it's you get in there, you do your IV, you put a little bit of pressure, you put a bandage and you put some tape over there. And you're like, oh, okay, we're good, right? And you're like, hey, bend your arm like this, hold it there, okay, yeah, we're good. Well, the next thing you know, she's over here looking at this and this arm, and so when you wrap up people on Coumadin, on blood thinners, good pressure wrap, all right? Good Coban wrap. All right. Abrasions, contusions, hematoma, you guys know all your decap, BTLS stuff, right? Lacerations.
Huh.
Oh. Right?
That happened.
Life-threatening.
No.
So, immediate life-threatening.
No.
Long-term life-threatening, maybe potential. What kind of thing do you think would cause something like this?
Wolverine.